Knowing that I am a Black doctor who works in a predominantly Black community, I think it's really important for me to give the best care to Black patients because that does not always happen. And I'm there as an advocate for them as well. And so they deserve the best, and that's what I'm here to give them.
Hi, this is Dr. Katie Patel, and this is your Global Health Colleague Consult. Good morning. Today I am lucky enough to have my former co-fellow and peds emergency attending Dr. Ashley Serrette with us. Good morning, Ashley.
Hey, good morning, Katie. Thanks so much for having me.
Of course. I'm really glad that we can spend some time talking about your passion. I wanted to just start things off with your path to global health.
Ever since I got into medical school, actually, even maybe before, I knew that I wanted to do some global health. During the summer after my first year, I was lucky enough to get a scholarship to go to Tanzania for about a month and work in one of the rural hospitals out there. When I got there, I loved it, and I knew that this was something that I wanted to do for the rest of my career. So that's kind of how I got started. From there, I looked for programs that had some sort of global health possibilities, I suppose. I actually worked with one of my attendings who also had an interest and passion for global health, and she really got me on the track to start that. When I was in residency, I was able to go to Malawi, Kenya, and that actually helped me choose fellowship in pediatric emergency medicine, which is, as an attending, I still do global health trips, and I'm doing a trip upcoming in August, which I'm really excited about.
You're also the founder of Go 36. Can you tell a little bit more about that organization?
Go 36 is a nonprofit organization that I founded just this year. Last year, I did a 2-week experience in Uganda, and I met up with a friend that I had met the first time I went to Tanzania when I was a medical student, and he's involved in a lot of rural outreach, and actually asked me to bring people out to go to the villages so that we can bring some healthcare, free healthcare to these populations who are in these rural villages. And I'm really excited about it. I really hope that, we can continue doing this for years to come.
So
Yeah.
let's say that there's a medical student who's interested in global health, but hasn't yet made those connections. Where do they start?
Just speaking from experience, I remember feeling overwhelmed. Like I knew I wanted to do this, but it was sort of like how, who, what, where, when, how. So it's sort of like identifying people or even just asking around experience. So that's really important because people with experience always want global health people love to meet other global health people. And if your program or your hospital doesn't immediately offer opportunities for trips or experiences or rotations, you can always join another college or another organization's trips. There's a lot of global health toolkits out there. I think one of the really great ones is the AAP has a global health toolkit that has so many things from how to look for these rotations, how to debrief the rotation, how to prepare for these rotations, what your packing list should be, all of those things.
Let's say that there is a medical student, they delved into those resources, they find yours, and they're the medical student on your trip. What do you think that medical student can do to stand out and impress you?
Be looking for like the cultural competency. So that's, for me, that's like number one. Just being aware of your surroundings and of the people you're around. I think if you have a true like strong interest, of course you want to go in there, see what it's all about, but at the same point, I would love to see a student who says, wow, I've just assessed the situation, it would be so great if we offered XYZ in terms of teaching or training the next time we come around. I think it would really like change the way certain things are done in the village that they can do themselves as well. Like I think the thing about global health that's super important that needs to be amplified is that just going in for a week or so to see patients and treat them is probably not always the greatest thing. We have to learn how to share our knowledge and our resources to those communities so that they can continue to provide, equitable healthcare to their communities as well. And
What do you think that that medical student now knows and can bring back to American medicine or the world of American healthcare that they wouldn't have known if they had never gone on a mission?
Is what the barriers are that you're dealing with in terms of providing the best healthcare. And
Mm.
I think that's something that most, not most, every single person in healthcare needs to witness, just so that they can understand what is available and really what they can do to provide the best healthcare for all their patients. Like, we really do have a lot at our fingertips here in the United States. We're very lucky. The number one thing in your toolkit is having like confidence and believing in yourself. If you're doing the best that you can do with what you have, really no one can fault you for the outcome.
You know, I feel like you alluding to the fact that you have to have some trust in your training and all of the hard work that you've done is so important, especially for being a woman in medicine, being a woman
Yeah.
minority in medicine.
Yeah.
Can you talk a little bit about how you tap into just taking ownership of that confidence in all of your expertise?
Being a Black doctor in medicine, it's a rarity. We're not everywhere.
Mm.
So there's
Yeah.
that. But then, because of that, you feel like you have to be, that much better than everyone else.
Mm.
You don't want to be the person bringing down your race. You don't want to be the person bringing down your gender. You don't want anyone to look at you and be like, because she's Black or because she's a woman,
Mm.
she is less than or not as good as. And so I think, unfortunately, that has definitely shaped how I have, worked in my field, and why I want so hard to be prepared and to be, you know, to do the best that I can.
So, Ashley, let's say that a medical student is really interested in pursuing global health and they're interested in your organization, Go 36. Where can they go for more information?
Okay, thank you so much for asking a question. Okay, so we have our website, www.go36.org, and we have an Instagram page at go36_org. And of course, you can always follow us on the website or reach out to me directly. And I would be so thrilled to have students join us next year.
Thank you so much for taking time to talk. I really appreciate it. And I know our global health interested students are going to love this information as well.